Good afternoon. I am Dr. Dan Hegarty, CEO of Express Medicals PLC, and it is my great pleasure to welcome you all to this webinar entitled Injury Prevention and Management. The session will be presented by Nell Mead, a very senior physiotherapist. Nell's career has been quite spectacular, and we are very fortunate at Express Medicals to now benefit from her expertise as our physio advisor. I'll tell you a little bit about Nell because her background is so interesting. Nell joined the British Army as its youngest physiotherapist, and then over the course of 10 years rose to the rank of Major and eventually became the head of physiotherapy for all British forces in Cyprus. Nell was thus a leader in a military physio and rehabilitation service that was world class. She gained vast experience of treating patients with multiple complex injuries and long-term rehabilitation issues. She was part of the British Army's first ever multidisciplinary assessment clinic while serving in Iraq in 2003, and this helped to establish the gold standard of carrying out simultaneous assessments by a doctor, a physiotherapist and a rehabilitation therapist to ensure that the injured received joined up optimal management. Serving in Cyprus, Nell set up intensive 3-week residential rehabilitation courses for severely injured personnel who required full-time rehabilitation. This involved around 5 hours each day of intensive physiotherapy and rehabilitation, and some amazing outcomes were achieved. This was actually Nell's own concept, and this has now become accepted practice throughout military service. Nowadays, Nell works in the civilian world and runs a successful central London practice. She treats a wide range of people from a diversity of sectors and often sees patients who have not achieved a successful outcome despite seeing other practitioners who have used more traditional methods. Many of her referrals come from leading surgeons and other health professionals. Nell is the only physiotherapist in the world to have completed dual training in both what is termed the integrated systems model and also the Sarah Key method. Nell is also a member of the Association of Physiotherapists in Occupational Health and Ergonomics and is thus trained to offer ergonomic advice. Taking advantage of this training, during the lockdown, she produced a very useful online course for those starting to work at home, and that was entitled Setting Up Your Home Workstation for Success. She has many accolades, but two of her most recent accolades include being named Best Physiotherapy Injury and Treatment Provider at the Global Healthcare and Pharmaceutical Awards in 2022 and Most Dedicated Physiotherapist in the Greater London Enterprise Awards of 2023. Her opinion is often sought by the media too. Finally, I would just like to mention that Nell Mead's own professional journey has included trying to reach out to as many people as possible who need physiotherapy, because this is against the background of a huge shortage of physios. In fact, there is less than one physio per 1,000 population in Britain at this time. To this end, she has introduced an excellent series of online courses. These are entitled How to Be Your Own Physio, and these are aimed at helping anyone who has musculoskeletal injuries but who might be struggling to access decent physiotherapy for whatever reason. That might be availability, location, cost. Those are certainly worth a look. Now, there will be the opportunity to post questions, so please do send them through, and we will address those after Nell's presentation. And so now it gives me great pleasure to hand over to Nell Mead.
Thank you, Dan. I sound amazing. Let's have a go. So welcome to Injury Prevention and Management. It's lovely to see everybody here. I'm just going to move myself to the top of the screen there. Don't know what you guys can see, but I can just see me in the middle. Huge thank you to Dan at Express Medicals for inviting me to come and talk to you today. And hopefully I'll be able to give you some useful and practical takeaways. That is me on the left of the screen, hard at work treating a patient. So as Dan said, I'm a specialist musculoskeletal physio. I've been qualified for over 23 years, and I spent my first 10 years in the British Army, ending up the British Forces Cyprus team. Now, I didn't invent the regional rehabilitation concept, but what I did do was I introduced it to Cyprus and I ran it completely there. But no, I didn't invent the concept, but I certainly took it and ran with it. Now, Dan has asked me to talk about the musculoskeletal health in physically demanding industries, and particularly in construction, rail, transport and logistics. As I understand, that's where the majority of people here will work. So you may have seen the stats that I sent out as part of the marketing piece for this talk. So in 2021-22, musculoskeletal disorders accounted for 27% of all work-related ill health cases in the UK, and 24% of all working days lost due to work-related ill health. That's huge. So the total number of working days lost due to work-related musculoskeletal disorders was 7.3 million days in 2021-22, which is about 15.2 days lost per case. And the construction industry is particularly affected, with almost double the average prevalence. So I'm going to start with some of the stats because I think it's really important to understand the impact of musculoskeletal injury on each of the sectors. We're going to be looking at working hours lost, money lost, and individuals who are suffering, because all of those are super important factors to manage and minimise, both from the employers and the employees' perspectives. Nobody wins when somebody gets injured. So then I'm going to talk about what we can do to reduce the risk of injury, because of course there will always be a risk. Life isn't perfect. We take a risk every time we cross the road, but the more we can do to identify potential hazards, assess the risk of things going wrong, and then put things in place to mitigate them, the fewer injuries we should see, whether that's traumatic injuries like a specific accident, or overuse or misuse injuries like developing back pain after you sit in a wonky or a stretched position for hours on end. So we're going to look at the extrinsic risks, which is about what you can do to make sure the environment and the task is suitable for the individual. And then we're going to look at the intrinsic risks, which is more my area, which is about whether the individual is or could be fit to do the tasks and how we can affect that. Then we're going to look at injury management, so best practice if somebody does get injured despite our best efforts. And then with Dan's permission, I'm going to introduce my online course called How to Be Your Own Physio. And we've clearly got quite a lot to get through in the next half an hour, so I'm going to ask you to hang on to any questions until the end, but you can put them in the Q&A bit, and then we'll address what we can at the end there. So let's have a look at some stats. So construction industry first, let's start with you. So a sector of around 3.1 million people, making up 9% of the total workforce in the UK. 74,000 construction workers were reported to be suffering from work-related ill health, as averaged out over the 3-year period of 18-19 to 2021. And of these illnesses, an estimated 40,000 workers, which is 1.8% of everybody in the sector, suffered from work-related cases of musculoskeletal disorders, compared to 1.1, so 1.8 in construction compared to 1.1 across all industries. So in other words, 54% of all ill health in the construction sector is caused by musculoskeletal problems. That's muscles, joints, tendons in any part of the body. And research from Loughborough in 2019 found that musculoskeletal disorders cost construction employers £646 million a year in the UK. So that's the construction industry, 646 million. Then we've got the rail industry, which is a sector with around 138,000 direct employees. Total sickness rate in the rail sector is 3.9%, which is more than double the 1.8% rate reported across the private sector as a whole. Around 25% of sick days lost in the rail industry are due to musculoskeletal problems. And they reckon that the RSSB's 2019 research on the cost of impaired health in the rail industry estimates that 1.34 million days are lost to sickness absence each year, costing around £355 million annually. So that's 89 million per year lost to musculoskeletal disorders. And then we've got the transport and logistics industry with a combined around 3.5 million people. So according to the Road Transport Industry Training Board, across the whole British workforce, there are 477,000 workers suffering annually from a work-related musculoskeletal disorder. And in transportation storage, musculoskeletal disorders are around the second most prominent cause of ill health at 36%, and around 17,000 cases reported. Around 1.4% of workers in road haulage and warehousing suffer from musculoskeletal disorders. Remember, the all industry rate is 1.1, so that's at 1.4. And the HSE report for 2021-22 says the estimated economic cost of ill health and injuries related to transport and storage workplaces is £823 million. So 36% is caused by musculoskeletal disorders. Then transport and logistics are losing nearly £300 million a year in the UK alone. So in other words, if we're looking at construction, we're looking at rail and we're looking at transport and logistics as a total, those sectors alone represent over 6.7 million people, so around 20% of the workforce in the UK, and musculoskeletal injuries are costing those industries over £1 billion a year. That's a lot. So what can we do about it? Well, we start off with managing the extrinsic risks, which is making the tasks fit for the individual. So that means all the stuff that you guys should be doing anyway. So it's the risk assessment and management. It's making the equipment fit the individual so that tasks are as appropriate as possible. It means following HSE guidance. It means workplace assessments, equipment assessments, proper training on safe working practices, wearing and using the right kit, robust leadership to make sure that standards are adhered to. And then if any of the assessments show up issues, or if individuals flag up problems either with their bodies or their equipment, then you have a duty of care to reduce the risk to the lowest practicable levels and then to reassess. And within your sectors, this is much more your area than mine, so I'm not going to teach you to suck eggs, but I do have a military example of this, and this is with marching. So when you learn to march in formation, like you see the ceremonial forces doing on TV, that you learn that there is a standard stride length of 30 inches. But as the forces started recruiting more women, because we are shorter in general, they started to realise that women were developing many more stress fractures in their hips and pelvises than men. So there's one study that shows that the rate of male pelvic stress fractures was 1 in 40,000 compared to 1 in 367 for women. And eventually what they realised was that the 30-inch stride was just too long for women with little legs, because every step they were yanking on their pelvic bones. So in the mid-1990s, they trialled reducing the stride length from 30 inches to 27 inches in female basic training, which is where you do the most marching. And they reduced the pelvic stress fracture rate to 0. So you've got to think about the size and the shape of the people doing the job and the size and the shape of what they're being asked to do and make sure that they fit together. So that's managing extrinsic risks. Managing the intrinsic risks, and we're going to talk a lot more about this in this presentation, is more about making sure the individuals are fit for the tasks. And I will go into this in more detail, but it's more about getting individuals to look after their health, their fitness, getting them to do manual handling training so that they're fit to undertake the tasks. It's about warming up. It's about taking movement breaks. It's about doing regular stretching. And it's about the physical specific risks associated with the individual's role and providing injury prevention advice. Now, I'm struggling to be too specific here because of the way that workplace musculoskeletal disorders are measured. Because as far as I can work out, and I have read a lot of occupational health papers, when it comes to stats, they're simply recorded as MSD, musculoskeletal disorder, with no record of types of injury, areas of injury, the patient's role, anything like that. So I'm going to quote management guru Peter Drucker here: if you don't measure it, you can't manage it. And in this case, if you're not detailed with your recording of injuries, it's hard to be specific with the risk management and injury prevention advice. However, when it comes to injury prevention in general, I want to introduce my health and performance pyramid, because this is how I work in clinic, and this is a representation of how I think the body works. If you've got all these building blocks in place, then I believe you should have normal, pain-free movement, a reduced risk of injury and illness, and an optimal chance of recovery from injury or illness. So the first thing to look at is the foundation layer at the bottom, which is hydration, nutrition, sleep, and stress. So the foundation layer, that bottom layer, is all about the health of the cells that form your tissues and your organs. So this is all about tissue metabolism. So it's a fancy way to say new stuff in, old stuff out. And essentially, if you've got the right nutrients going into your cells and waste products going out efficiently, then the environment within your cells will be healthy, and you as an overall structure will be more robust. So you'll be more resilient against injury or illness and quicker to heal should you become sick or injured. But if you're not on top of the big four, hydration, nutrition, sleep, and stress, then your cell environment will not be as healthy as it could be, and you will respond less effectively to injury treatment or fitness training. So this is one of the first things that I discuss with my patients when I see them in clinic. Now, I can talk about that stuff literally for hours. I have done on many occasions, but I'm just going to give you the really big takeaways now on those four. So hydration. A good rule of thumb is to have a glass of water or a cup of green tea every hour for 8 hours a day, because that will make you keep getting up to get the water and to go to the loo. So it'll force you to move. Nutrition, try and have some form of protein with every meal. Make sure you're getting plenty of vegetables and omega-3s every day, and avoid getting too much ultra-processed food. If your food came out of the ground or had a face, then it's going to be better for you than if it came out of a factory. Sleep, aim for 8 hours in bed, which will eventually balance out to around 7.5 hours of sleep time, and be as consistent as you can with the times you go to bed and the times you get up. We know that shift workers and people who keep changing time zones, so cabin crew, pilots, etc., they have more health issues than people who are consistent with their sleep patterns. And with stress, the biggest tip is to learn how to breathe, because the benefits of breathing through your nose and using your diaphragm properly are incredible. And again, I can talk at length about that for hours. I have almost an entire online course on it. However, learn to breathe, use your diaphragm. Let's go into more detail about managing the intrinsic risks of physical work. So remember, this is about ensuring that the individual is fit to undertake the tasks. So managing the extrinsic risks by making sure the tasks aren't excessively risky or demanding isn't the only thing we need to consider, because we know that the fitter you are, the less likely you are to pick up injuries. And I'm going to quote from a study here from 2015. Individuals with lower levels of cardiorespiratory endurance or muscular endurance, so lower levels, are more likely to be injured. And improving fitness lowers injury risk. Those who are more fit perform activity at a lower percentage of their maximal capability, and so can perform the task for a longer period of time. Fatigue less rapidly, recover faster, and have greater reserve capacity for subsequent tasks. Fatigue alters movement patterns, putting stress on parts of the body that are unaccustomed to it, and possibly increasing the likelihood of injury. So the fitter you are, the less likely you are to get injured. So where possible, we as leaders need to encourage people to get and to stay as fit as they reasonably can. That means education about health and fitness, so posters and brochures around the workplace. It means workshops to encourage discussion and questioning. And it means making sure that there are facilities to enable people to eat well. It might mean wellness challenges like step counts or virtual races. It might mean team sports like organising a football or a netball tournament. People who exercise together are more likely to exercise at all in general, huge generalisation, but they're also more likely to feel positive about it. So if it's possible to facilitate that, then it's worth doing. We also know that you're more likely to get injured if you stay still for long periods, whether you're sitting or standing. So the number of people I see who come in and they say they've got back pain, and I go, how long do you sit each day? And they go, 14 hours. Yeah. So you're more likely to get injured if you sit still for long periods. And we also know that if you go from a period of being very sedentary to suddenly asking your body to perform high load or awkward tasks, then you're more likely to pick up muscle strains, tendon strains, disc injuries, that sort of thing. And I found in the research base, I found a multi-center study that was done on orthopedic surgeons. So orthopedic surgeons spend long hours in awkward positions while they're operating, because with surgery, you have to be really careful with being sterile. There's a lot of sort of reaching over and standing in very odd positions for long periods. And they found that when they made the surgeons take short breaks, so these were surgeons who were all scrubbed up wearing their sterile kit, and they made them take short stretching breaks in between operations. And they then questioned the surgeons and did questionnaires as to how they felt afterwards. And the outcome was that the surgeons described experiencing significantly less discomfort and fatigue, with increased subjective ratings of physical performance, mental focus, and without increasing their surgical duration times, so stretching breaks. So how do we do that in practice? Well, the key points are that we want to be efficient. So we want to do movements that encompass as much of the body as possible, taking the body through the greatest possible ranges of motion with minimal risk and no equipment, so that we get the biggest bang for our buck as quickly and as simply as possible. So I'm going to play you a video that I made, because it's easier than making sure I'm in shot perfectly when I'm jumping up and down. And I'd like you to follow along, as I will be too. So before you start, though, I want you to notice how you're feeling. So are you feeling stiff? Are you feeling tired? Are you feeling tight? Does anything hurt? Are you bored? How's your mental state? So imagine a scale where 0 means you're feeling basically dead and 100 means you're feeling great. And just take 2 seconds to give yourself an overall score. So hopefully you've taken 2 seconds to give yourself an overall score. And then I'm going to play you a video and I would like you to dance along with this. So somewhere on my screen, I'm supposed to be able to show you this. Let's have a look.
So we're going to sprint through a 5-minute daily stretch. The first thing we're going to do is clavicle stimulation. Now the clavicle or collarbone tends to get sticky and tight when we're working or when we're stressed, which is a problem because the internal jugular vein and the subclavian vein run between the clavicle and the first rib, plus there's a bunch of important nerves and lymphatic vessels there. So by wiggling and stimulating around the clavicle, we encourage better blood and lymphatic flow to and from the brain and a better blood and nerve supply to the arms. And then all the bouncing around and stretching in the next few minutes will stimulate better fluid flow around your body. So Sabrina's going to start by massaging in little circles underneath the bottom edge of her left clavicle. She's going to spend 8 or 10 seconds just massaging under the clavicle from the inner edge to the outer edge. Good. Now she's going to do the same thing above the clavicle. So again, almost trying to wiggle her fingers under the upper edge of the clavicle, trying to create space between the clavicle and the rib cage. Again, 8 to 10 seconds. And now she's going to rub both hands firmly over the clavicle, up and down, sliding the skin over the bone and just generally getting things moving in there. Lovely. Thank you, Sabrina. So now we're going to do exactly the same thing for the right side. So coming with your right fingers under the left fingers underneath the right clavicle to start with, 8 to 10 seconds, little circles, almost trying to get your fingers to burrow underneath the bottom edge of the clavicle. Good. Now the same thing for the upper edge. Really get your fingers in there, try and wiggle in between the neck and the top edge of the clavicle, try and create space under the collarbone. Good. Now nice and firm, both hands, one hand supporting the other, dragging the skin over the bones, really get everything stimulated. Great. That's the clavicle. Move on. So the biggest and most expansive plane of movement in the body is flexion, so touching your toes, then moving to extension, which is up to the sky and back behind you. So Sabrina, you're going to start by tucking your pelvis under so your knees soften, your little lower back muscles are primed to support you. Then you're going to drop your chin down to your chest and drop your shoulders forward. Drop your rib cage onto your belly, start curling down. Now as Sabrina curls down, you'll see that as her head comes forward, her bottom goes back, so she's counterbalancing, she's not going to fall over. Good. Let your knees bend, drop your head, come right the way down into gorilla pose where you're hanging and everything is nice and relaxed, belly on your thighs. Hang there for a couple of seconds, take a couple of nice deep breaths right down to the diaphragm, still letting the back of your neck go, and then we're going to curl back up. So to come back up, it's knees forward, hips forward, head comes up last. Beautiful. So let's do that again a bit faster. So pelvis tucked under, drop your head, let your shoulders drop forward, rib cage onto your belly as you curl down, head comes forward, bottom goes back, so you're nice and stable over your arches. Knees are bending as much as you need to so that your head and hands can drop. Couple of nice deep breaths. Then to come back up, it's knees forward, hips forward, head comes up last. And this time we're going to reach for the sky and go all the way back as far as you can up onto tiptoes. Push those hips forward and shoulders back. Nice. Now, if you're comfortable, we're going to put all that together into a swinging motion. So if you watch Sabrina, you'll notice that her technique stays much the same. So she's staying balanced over her arches as she curls down into gorilla pose. And then again, she's nice and safe with knees forward, hips forward, head coming up last before she reaches for the sky. Good, so now we're going to change planes and go for some side flexions. So start with your feet hip width apart, get centered over your feet and push down slightly through your big toes. Then we're going to start by getting your hips to slide across each way, so you stretch between your pelvis and your rib cage. Your pelvis will counterbalance your head, so your weight stays over a point between your feet. So the further your head goes one way, the further your pelvis needs to go the other way. And the further your pelvis goes, the more you stretch the side of your lower back as it pulls away from your rib cage. Good. Okay, so slide your left hand down the side of your leg. And as you go down, take your weight onto your right foot, push out your right hip. Your right leg wants to be about as diagonal as you can get it, and your right hip as far out to the side as you can. So keep pushing through that right big toe into the ground. Take a couple of breaths and really stretch the outside of your right hip. Good. Now come back up. Let's do the other side. So sliding your right hand down the right side of your right leg. As you go down, weights on your left foot. Push out your left hip so your leg's on the diagonal. Push down through that left big toe. And you can see the lines on the wall behind Sabrina. You can see how far she's shifting. So just speed that up a bit, Sabrina, just getting your hips to glide from left to right and right to left. Good. Now we're going to add in the arms. So again, lean to the left, push your hips to the right as far as you can, take your right arm up and over your head as far as you can, so you're getting maximum stretch to the right side of your rib cage. Then add in a breath, so breathe into your right lung to increase the stretch. Good. Now the other way, so lean to the right, push your hips to the left as far as you can, take your left arm up and over, and get the maximum stretch to the left side of the rib cage, and add a breath, breathe into that left lung to increase the stretch. Nice. The last big plane of movement of the body is rotation. So again, we're going to start from the bottom and work up. So feet hip width apart. Just want you to imagine you've got a laser beam coming from your belly button. I want you to think about moving that laser in as wide a circle as you can. So your weight's going to stay over the middle of your feet, but you're going to twist from the belly as far as you can to the left and then as far as you can to the right. Nice, just do that a few times as far as you can. Good. Now we're going to add into the rib cage, so I want you to hold onto your elbows and then pull your left elbow around to the right as far as you can. Take a deep breath in, and then as you breathe out, come back to center. Good. Now pull it around to the left as far as you can. Deep breath in, and as you breathe out, come back to center. Once more, turn right, deep breath. Good, back to center. Turn left, deep breath. Good, back to center. And finally, we're going to add in your neck. So pull around to the right again, and this time look as far over your right shoulder as you can. That's it, nice. Hold it and take a breath. And then as you breathe out, come back to center, and then go the other way. So pull your elbow around to the left, look as far over your left shoulder as you can. Good, hold it, take a breath. And then as you breathe out, come back to center. We're going to finish with a bit of a shakeout to stimulate your nervous system and your lymphatic system, get everything woken up. So we're going to spend 20 seconds just bouncing on our toes. If your knees are comfortable, you can jump up and down, or you can just bounce without actually leaving the ground if you'd rather. Good. Then you're going to shake out your right leg, give it a good old shake. Nice. Then your left leg, shake it out, give it a good old wiggle. Beautiful. Move up to your arms, shake them out, start low at your hips and then bring them up, shaking all the way till they're over your head. Nice. And then relax your arms. We're going to do some head circles to finish with. So a couple of circles clockwise and a couple of circles anti-clockwise. Don't push into any pain. Just keep it nice and relaxed. Good. And then the other way. Beautiful. And you're done. How are you feeling?
So, how are you feeling now? Are you feeling the cues I gave you? Stiff, tired, bored? Does anything hurt? Remember, giving yourself an overall score again. So 0 means you're half dead and 100 means you're feeling great. How does your score now compare to before you had a movement break? Does anybody feel more alert and more comfortable? Have a think. So then we can move on to, that's a big suggestion for being proactive, taking short movement breaks and doing something like that video. So feel free to pass that video on. But what do we do for the best if, despite our best prevention efforts, somebody does get injured? So the first thing is early recognition of symptoms. It's much quicker and easier to treat problems if you catch them early. But I grew up as an adult in an environment where it was all about no pain, no gain. And I'm guessing that my industry, the military industry, was not the only one that was like that. So let's think about some strategies to create a supportive work environment that encourages reporting and addressing musculoskeletal issues, because that's what it takes to nip problems in the bud. So the first thing is about open communication. So encouraging your staff to openly discuss any issues and make it clear to them that it's a priority. Then we've got to think about education, so providing information and resources about musculoskeletal health and good ergonomics, and about their responsibilities with regard to health and safety. So they've got a greater understanding of how to address and prevent injuries. And finally, you've got to implement a reporting system so they can easily and safely report any issues and concerns, and you've got to make sure that you respond, because if you don't respond, they will lose faith. Then if they do report an injury, the newest acronym, so we all know RICE, right? Rest, ice, compression, elevation. But the new one is peace and love, man. So you start with peace. So this is when you have a new injury, it's time for peace. It's protection, elevation, that's P-E. A is avoid anti-inflammatories, because we need inflammation. It's the first stage of the healing process. So if we start off by taking ibuprofen, we are actually hindering the healing process, we believe. And then the C is compression. So we're still doing that. Maybe not tube grip, it's not great, but you can use any sort of bandaging. And then education, so how to manage it. And then once the injury starts to settle down, you move on to love. Love is loading, so starting to put some weight through the injury, starting to lift some weights, whatever it is, depending on where the injury is. Optimism, because an optimistic mental state gives you much better injury outcomes. It's vascularization, so start getting the blood flowing. And it's exercise, again, may well be to get the blood flowing again, so it may well be the same sort of thing. But you may sometimes want to seek professional help though, and you do that at the acute stage if there's any obvious deformity, so if there's clearly a broken or a dislocated bone, or if you can't take any weight through the injury, or if you've got pain or swelling that's getting worse rather than better, or if you've got any neural symptoms, so shooting pains, numbness, or painless weakness. Because if you've got painful weakness, you might have strained something, but if there's weakness but no pain, that generally means a nerve injury. Or of course, if there's any head or spinal trauma, and those are all hospital jobs. But at the subacute or slightly later stage, you might also want to see a professional, a doctor or a physio, if the problem starts getting worse or doesn't get better, or if you're struggling to walk or do your normal activities, or if you start noticing any weakness. So those are the times to get professional help. But I've also been working on a directed self-help option for the people with injuries who don't want or need individual professional help. And this is my online video-based course. It's called How to Be Your Own Physio. So the idea of this is that it lets individuals take charge of their own health, and it's based around function rather than around pain, because the idea is that if you move well, in general, you shouldn't hurt. So you start with a free self-assessment course. So you follow a series of videos that teach you to relax and test each area of your body in turn, and you fill out a self-assessment form as you go. And by the end of that course, you should have a better understanding of where in your body your problem is really coming from. Because once we've got a problem, we often develop compensation patterns. They cause problems further elsewhere in the body. And so the first thing is to work out where it's all really coming from. And once you've worked that out, it directs you to buy the rehab course that's indicated by the results of your self-assessment course. And along the way, you learn about your anatomy, how the body works. You test how good you are on sleep, stress, hydration, nutrition, all the foundation pieces, and you get tips on how to optimize your recovery. So it's a DIY version of the way I work in clinic. And it's new, but the exercises we filmed are similar to the one with the speedy stretches that I just showed you. And they're the same exercises I've been using successfully with my patients for years. So I'm really hopeful that this is going to help an awful lot of people who don't want or can't afford the time and the cash to pay for physio, because let's face it, even NHS physio costs you in terms of travel and time. So that's my new course, is How to Be Your Own Physio. So what have we been through today? It's been a whistle stop half an hour. So we've talked about the stats so that we understand the scope of the problem, the importance of prioritizing musculoskeletal health to benefit both employees and the company's bottom line. We've talked about the extrinsic measures to reduce the risk of musculoskeletal injury. So that's about the risk assessment, the ergonomics, the training, the reporting, and the robust management. We've talked about the intrinsic risk management measures, so getting the individual fit to manage the tasks, which is about the education, exercise, and regular movement. So we did the speedy stretching routine. We've talked about early recognition, so that's peace and love, and about when to refer professional help. And I've introduced my new DIY assessment and treatment courses. And if you'd like to try the free course, then I'm going to put a link on the next slide. But I would like to thank you all for staying awake and interested, if you have. And I'd like to thank Dan and Express Medicals for inviting me to talk. Hopefully you found at least some of it useful. Does anybody have any questions?
Well, thank you very much, Nell, for what was a very enlightening talk. Plenty of information there, and I'm sure the audience have found that most helpful. Moving on, there are just a small number of questions in, so perhaps we'll run through them and you can try and answer them for us all. Yeah, the first one is regarding the peace and love approach to injury management. Can you explain how each component works in more detail and perhaps give some examples of when to apply them?
Okay, so peace and love, they're two separate parts of the treatment process. So the peace part is when you've got the acute injury. And so peace is about protections. That's, wearing, maybe, using crutches or wearing a splint or something like that. Then so that's P. Then the E is elevation. So we know that from RICE protection. Rest ice protector can, good lord, rest ice compression elevation. So we know that lifting the injured part above the groin or above the heart helps with the drainage and helps that to get more comfortable. The A is avoiding anti-inflammatories, because we now think that if you take ibuprofen in the early days or another anti-inflammatory in the early days after an injury, that can actually slow down the healing process, because we want the inflammation is the first stage of healing. So we want that in there. Then the C is compression. Again, we know that one from before. So that's, putting a bandage on, bit of tubing grip, something like that. And E is the education. So it's talking about, what to expect from the injury. So it's understanding that. So that's the peace side, which is your acute treatment. And then love the important part, this is the part that wasn't involved in RICE. So this is the new stuff. So this is about what you do after the acute injury. And so the L is load. So we're gradually putting weight back through the injured part. And then you've got the O, the optimism, which is maintaining your positive mindset for recovery. The V is the vascularization, the easy exercise. So we're starting to get a bit more movement, get a bit more blood flow, because that's going to bring, as you know very well, your healing chemicals and get things working so that we can start to strengthen again and start to use the injured body part more again. So yeah, peace and love is just that bit more thorough and more comprehensive than the old RICE.
Okay, thank you very much for that. There's a second question in. It says, in physically demanding industries, how can companies strike a balance between productivity and employee health, especially when there are time constraints?
Yeah, well, it's interesting, isn't it? I mean, there's that quote, if you don't make time for your wellness, you're going to have to make time for your illness.
Yes.
and unfortunately, it's so true. But as we saw with the surgeon example that I talked about earlier, so when the surgeons in the operating theatres took short stretching breaks, they felt less discomfort, less fatigue, and they performed better. But everything didn't actually take longer, so they were more effective and more efficient when they were working, when they'd had the short stretching breaks. So I think the point of taking short movement breaks is that it makes you more productive, not less. But having said that, I mean, of course, not everything that you can do to help with health and productivity is hugely time consuming. So just doing the right, setting things up right in the first place, so making sure your equipment fits, that's going to take very little time, but it's going to give you a big payoff. Or you might be able to rotate through tasks so that people do different things at different times of day, so they're using different body parts and the tasks are still getting done. But if they get done by one person in the morning and the other person in the afternoon, and then they swap, then you're going to get, each person's going to be better off for that. So sometimes it's just a bit about being a bit creative with it. But yeah.
Okay, thanks for that. Another question here. What are some common misconceptions about musculoskeletal health that you have encountered in your own practice, and how can we address them effectively?
Oh God, I hear people coming into my clinic all the time with some really funky ideas. Okay, so how about pain is just a natural part of aging. As you get older, you naturally hurt more. So I get people coming in and going, well, of course my hip hurts, I'm just getting old. And I'm like, nope. It's not about the age, it's about the mileage and it's about the misuse. Right. So if you've developed some funky movement patterns and then you do them for a long period because you're older, then it's how long you've been doing the funky movement pattern that tends to be what upsets you, as opposed to just the fact of being older. So, don't assume that you have to be broken just because you're getting on a bit. Come and get looked at, come and get sorted out, get your movement patterns sorted out, and you can be just as pain-free when you're older as you can be when you're younger. So that's one. Then posture. Now this is one that other people come in and they're like, but I sit up really tall and really straight all day long, so why does my back hurt? And I'm like, the biggest thing that's going to sort out your back and your neck is regular movement. It's not about sitting up straight like a guardsman. We're not, your spine is meant to move like a snake, not be there like a stick. It's not a reinforced steel joist inside you. There's supposed to be movement. So it's taking the body through full range and keeping it, staying fit and healthy is going to be much better for you than focusing on being tall and jammed in that position. And if you do start developing problems, get them checked out early, sort out the root cause. Don't just sort of mask it with painkillers. It's get the movement back, get the good quality movement back, and then you'll get out of pain. Don't just assume that if you stay still and take painkillers that you'll be fine. You won't.
So the answer there is early assessment and good early intervention. Exactly.
Yeah, it's all about that. That's what we should be doing for pain, is recognise it early, do something about it. Don't just go for rest and painkillers. It's not the solution.
Okay. One other here. You mentioned at some point, I remember, that musculoskeletal injuries, the way they're recorded, can make it rather tricky to be effective with prevention measures. How would you like such injuries to be recorded to improve matters?
Well, when I looked through the literature, all I could find was MSD, musculoskeletal disorder, being recorded. Okay? Now, bodies are complex beasties. So the idea that we can just say musculoskeletal disorder and put in a prevention program feels to me a little bit crazy, because we don't know exactly what we're preventing, and we don't know why we're preventing it, or when we're preventing it, or any of that sort of stuff. So for me, I think the things to sort of add into a recording routine would be things like, what is the person's role? Because somebody who's driving a truck is going to be working very differently to somebody in a warehouse, or somebody who's driving a train, or somebody who's a conductor. It's all going to be different, right? So their role, which body part is injured, because preventing an ankle sprain is very different to preventing neck pain. The type of injury, so is it a fracture, is it a strain, is it overuse, is it dislocation, so type of injury and the severity of the injury. And if we had just those four, I think even then we could do a lot to be like, well, actually, we've noticed that all our office workers have back pain. So let's now have a look at that. And so it's noticing patterns, but we can't look at patterns if all we have is MSD. Doesn't work.
All right, yeah, no, very clear. Okay,
yeah.
Finally, I'd just like to ask you something myself that I've written down here. You introduced those how to be your own physio courses.
Yes.
Which I found quite interesting myself. I have looked at them actually. How can people determine if these courses are suitable for their own specific musculoskeletal injuries or issues, and what benefits can they actually really hope to achieve if they do undertake any of these courses?
So the thing about the courses is that I think around 70% of patients who come in through my door, their problem is really coming from the thing that hurts. So their knee pain is really coming from the knee. But around 30%, the knee is compensating for something else in the body. And that's the big thing that these courses teach you, is to work out whether your pain is really coming from your knee or whatever it is, or whether it's compensatory. And if it's compensatory, what it's compensating for. So, for example, I had a chap in this morning, right? So he's had knee pain for 10 years, and he's seen all the good physios for knees, and he's been given all the magic knee exercises. And he came in, and I was like, yeah, your quads are strong. This, all the knee stuff is working well, but your hips really wonky and your glutes are really weak. And so what we learned was that every time he steps onto his right foot, his hip twists, and so he gets pain in his knee. And so that's why his knee's still hurting. Whereas for him, his knee is compensating for his hip. So if we sort his hip out, which we did this morning, if we sort his hip out, then his knee stops hurting. So that's the sort of thing that I would hope that people will learn from the courses. So if he was going to do the self-testing course as opposed to coming in to see me, then that self-testing should show up a hip problem, and then he'd follow that up with the hip rehab course, and at the end of that, his knee should feel better. So that's really what we're looking at.
Okay, so thank you very much, Nell. I think the whole webinar has been very, very not only interesting but very useful. I do believe that this will be available on our YouTube channel, and so I just say thank you, Nell, for your presentation, and thanks to the audience for joining us, and I hope you've all found it very helpful. Bye now.